Hello, everyone, and welcome to RevMD Sex Plates podcast with me, your host, Dr. Deborah Durst, and my co-host, Faraday Golembieski.
Hey guys, Faraday Golembieski, nurse practitioner here at RevitalyzeMD, and we are here today to talk a little bit about O-shot and nipple sensitivity and
nipple PRP. So with the O-shot, we can also place PRP under your nipples for great benefits. And we'll talk about that. So what is the O-shot? We've talked about the O-shot before. It's been a little while, so we thought we would revisit this because we do it on a daily basis. And so O-shot is putting PRP in the clitoris and the G-spot or the vaginal wall to increase all kinds of things. Collagen, elastin, urethral support.
Get those growth factors talking to each other.
That's right. Increased blood flow and increased nerve sensitivity. So increased orgasmic strength.
It helps with urinary incontinence as well.
Yeah. All kinds of benefits. So, what is PRP? So if we're drawing blood and spinning it down, we're getting the platelet-rich plasma part.
Yeah.
And then those platelets have growth factors in them. So we're then going to re-inject them into an area that stimulates with, or that communicates with the stem cells in the area.
So when we're drawing your blood and spinning it down, we're pulling off that very concentrated liquid gold. Sometimes you guys hear it as liquid gold. Sometimes you hear it as PRP. You hear it for the face. You hear it for hair. You hear it kind of for
anywhere, yes.
But we're talking about the clitoris and the G-spot.
Yes. And while it sounds painful, it actually is not painful at all. It is something very comfortable. And again, women will never believe you until you have actually experienced it. But usually at the end of it all, they're like, that's it.
That's it. We're usually just chit-chatting through the whole procedure.
Yeah.
No big deal.
That's it. It's over. So again, usually 0 to 1, if anything, with discomfort. And with our O-shots, we're not only going to place some topical, but we're going to go ahead and we're going to inject and block the clitoris. And then we're still icing before we do it. So we're doing all kinds of things to minimize pain.
Everything possible so that there is no pain with the procedure. So a little bit of lidocaine can go a long way.
Yeah, that's right. To better sensitivity in the long run.
Yes. So with the O-shot, typically what we tell women is that a lot of women will say they see an immediate effect right after the O-shot positively, but whether that is with decreased urinary incontinence, but really the O-shot's max benefit is 3 to 4 months after we do the O-shot because it's regenerative. It's true change. Yes. So that takes time. That is not an immediate thing. So even though some women do say they have an immediate improvement, and I think they do.
No, in fact, they do. I mean, I know that's the case because I had that with my first O-shot. And with 3 children, you'll notice an immediate, number one, you notice changes over time with 3 children. And again, childbirth, the vaginal canal, the G-spot, there's all kinds of changes that happen. But right after mine, again, it was immediate. Doesn't make sense to me from a scientific standpoint because it seems like it should be longer. But whether that space just retains the PRP we're putting in,
space just kind of holds.
Yeah, just holds it and supports the urethra. So it's not an expectation you should have after the O-shot. You should expect that it'll take a little more time. But if you happen to get immediate benefit, then great. That is an added boost to go home and have immediate improvement in urinary incontinence, which is the thing that we hear the most with immediate improvement. So,
and then the increased orgasmic strength and increase in being able to have an orgasm. We hear that as well, but that does take a little bit more time. Those growth factors are talking to the stem cells in the area and building that collagen and elastin and truly regenerating. It takes some time.
Yeah, it takes a little bit more time for that. So PRP again, we draw blood, spin it down, like Faraday said.
Blood. Let's make that because I had someone ask me if we get blood from somebody else, and I'm like, no, we draw your blood.
We're always using your blood to regenerate tissue. So we draw your blood, spin it down, get the platelet-rich plasma. And like Faraday said, that is the serum that has all the platelets in it. It has growth factors in it. And then we're re-injecting to get stimulation of the stem cells, which are going to build collagen, elastin, support the urethra for urinary incontinence. But we're going through the G-spot and the clitoris to improve blood flow, get improved blood vessels or blood vessel health, and then increase nerve sensitivity.
Yeah, getting those nerves talking to each other.
Yeah. So then all of that helps. And we do combine our O-shots with some vaginal rejuvenation. And then we have
Absolutely.
some other things that we use in addition to that will be continued regeneration at home, some home devices that we use and some arousal stuff. You know, we got all kinds of, we're very comprehensive in our approach.
We get it from all the angles, ladies.
All the angles. You know, we want to get results. So we have great results. That's our goal, is if we have to combine multiple different things and do it in a comprehensive manner, then that's going to get you the best results, and including hormone optimization frequently, because
Of course.
women don't think about testosterone and, you know, and their need for testosterone for increased libido and, you know,
or even estrogen therapy for atrophy. So
Yeah.
what I tell a lot of my female patients is, if we can do all the things, right? We've got all the things. We can do it all. But if we don't fix the underlying cause,
Mhm.
then you're going to see some improvement, but then you're going to see regression in those improvements. So if we're not hormonally optimized and we're of an age where we need to be hormonally optimized, or we have some stuff going on, if we don't fix that, then our sustained results are not going to be as long, which it can be frustrating for a lot of women if they're taking this time to invest in themselves and then seeing a backwards progression down the road sooner than they wanted to. But a lot of times that's because we haven't fixed the underlying problem.
Yeah.
We have low estrogen. We're going to have atrophy.
Yeah.
We're going to be have some vaginal dryness. So while the O-shot and some of our laser treatments and some of the other treatments we do can help with vaginal lubrication and improved orgasm strength, if we're not fixing those underlying problems, they come back.
You don't get the sustained results that you want. And the big thing is that cell health. So like our goal is to improve cellular health. So we want to optimize it from all levels. So if we're hitting the laser and the heat is regenerating and telling it it's injured, the tissue is going to repair. Then we're dumping a bunch of growth factors in, and then we're hormonally optimizing with all the hormones. And so everything is working again. And even IV therapy can help with, you know, sexual optimization. So there's so many different things. You just need to make sure that you approach it from a comprehensive manner, which brings me to the next topic. So we just wanted to kind of touch on O-shot again, because it's one of our favorite procedures in the office. But along with that, we will take PRP that we get and put it under the nipple. And so if you haven't heard of PRP under the nipple and all the benefits that it can have, then we just want to tell you about a few of them right now.
So just like PRP in the G-spot or through the clitoral hood, when we go under the nipples, we increase sensitivity. And this can be important for women for lots of reasons, whether that sensitivity has decreased over time. And I mean, the nipples are an erogenous zone. They can help with arousal. They can help with stimulation. Some women can just orgasm from having their nipples stimulated. So we don't want to lose that sensitivity. So it can help bring that back. Or after breast augmentation, sometimes we lose sensitivity because of those nerves. Breastfeeding.
You know, that breastfeeding is tough. Those babies are tough on the nipples. And sometimes it even hurts with breastfeeding, but definitely a decrease in sensation. And we frequently hear women say, oh, yeah, no, like, because we'll be doing the O-shot, and sometimes then we start to talk. We're not talking about the nipple PRP usually prior to the O-shot. People aren't coming in for that reason, because women just assume that decrease in sensation is normal. So they are all like, how, if we talk about and ask them how their nipple sensitivity is, if they've had previous breast surgery, breastfeeding, they're all like, yeah, no, it's not there. But that's normal. Like, they don't expect that they can see improvement in that.
We can fix that.
We can fix it. We're going to put this underneath and you're going to be happy about it. There have been women that have come back just for nipple PRP after, and not another O-shot, because they absolutely love it. Like, love it.
And this is not just women. We offer it for our men too when we're doing the P-shot. So we talk about the P-shot, which is PRP that is spun down. Same process, your blood spun down and then injected into the penis to help with sexual function. And then
heart erections.
At that time.
So if you want your man to have a heart erection, or if you want a heart erection, P-shot is perfect for
blood flow. Absolutely. Then we also offer our men as well nipple injections with PRP, with what's
and
left over.
believe it or not, they do want it.
It's like one or the other.
Depends on the man.
It's either like no or tell me more about that.
Some of them surprises me how quickly they know where we're going with the question. So if we're like, we have extra PRP, would you like some under? And I don't even get the word nipple out, and they're like, no. Yeah.
And they're like, well, hold on a minute.
Yeah. So I'm kind of surprised how quickly they say no. But some of them, once we have that discussion, again, it's about opening discussions.
Yeah.
Why wouldn't you want a little sensitivity to your nipple? Maybe add some
Absolutely.
other angle to sexual stimulation and arousal. So, and we've had positive feedback with our nipple PRP under the nipples for men. So they like it once they do it.
Exactly.
So I would just
we don't discriminate.
No.
We get both the guys and the girls in
That's
here.
right. Yeah, no man left behind.
Exactly.
We want to hit all those erogenous zones for you. And the nipples are one of them. So speaking of that, so lots of nerve fibers in the nipple. And so it is an erogenous zone for men and women, but more frequently for women. Yeah. And, so we are just going into a few facts, but then I think we'll do another podcast just on nipples. Not only nipple PRP, but nipple facts.
Because we found so much.
Yeah, we found a ton.
Yeah.
More than we thought we would.
Exactly. Before this podcast, our camera guy said, well, do you know any percentages of women that are stimulated by their nipples? And we're like, well, let's see what we can find. And we found a lot. That's why we're going to do a second one.
Then he said something about like, hey, is it normal for men to have like a couple different nipples on one side? And, so I think those
were nipples. I mean, it got kind of weird for a minute.
Those were a little weird. I think those are kind of personal questions. So like he was requesting a nipple, talk.
So we're going to do a nipple topic. But according to a study in 2006, manipulation of the nipples and breasts caused enhanced sexual arousal in 82% of women and 52% of men. Only 7 to 8% of those in the study said that it decreased their arousal. So we know a huge population, half or more, are aroused by their nipples being stimulated. Yeah. So why wouldn't we want to increase sensitivity there?
And a lot of people are not asking. Even though there's a lot asking, there's a huge percentage not. So again, maybe just opening those conversations or at least attempting stimulation, because a lot of times I think you're going to get feedback one way or another, whether that works, whether that is what they like. Because again, nipple stimulation can be squeezing or pinching, or some people like blowing. It could be just
light touch.
Yeah, just, a rubbing back and forth. And so it just depends on what they like.
We did a podcast on masturbation that you can listen to. And again, it's just learning your body, finding out what you like, what you don't like to enhance your own sexual experiences. So definitely check that out if that's something that you're interested in. But nipples are one of those things.
Very erogenous. So there's multiple different nipple types. The nipple is actually the center protrusion. There's the color,
not
which
the
is
areola.
The areola.
Yep, they're two separate parts.
Two separate parts. And again, areola size, nipple size varies with sex, varies with like pregnancy, hormonal, status, all kinds of things. There's different colors.
Yeah.
Inverted could be normal.
Flat.
Yeah.
Protruding.
Yes. You can have multiple nipples on one side. Or no nipples. A little bit less common to have no.
But you can have no nipples. I never knew that.
Yeah. And we actually had a discussion about, how we would feel if like we found no nipples. So anyhow, very interesting.
Again, the camera guy said, well, what if you met a guy with no nipples? I said, well, I guess it depends on the guy.
It turned weird again. There's lots of weirdness, but there was a reason for this podcast. Let's just say that.
Exactly.
And then, nipple pain can happen. That depends on hormonal stuff, and nipple tattoos are common, or piercings. Okay. Again, piercing can increase sensitivity with some, but it can also decrease it. Yeah. So there's all kinds of different,
but that's any kind of piercing. 'Cause there's clitoral piercings too, that some women love and are like, it's the most amazing thing in the world. And other women go, man, I was in that rare group that it seems like it's harder for me to now have an orgasm.
Yeah.
And I think that's more probably, I would think, error of the piercer, but I don't know.
Well, I think, or, again,
you hit a nerve.
Yeah, maybe. And there's like different nerves to like, the areola versus the nipples. So, and I think again, if there's trauma, it seems to me like that would be kind of common.
Yeah.
You're putting on a shirt and how piercings of the ear, it pulls on your earring and you're putting on a sweater. So it seems to me like that would be, but interesting. But I will say that again, PRP, spinning it down, getting those platelet-rich plasma and platelets and growth factors and injecting them under the nipples. If you've had breast surgery, if you've had multiple children, and if you have decreased sensitivity, and breastfeeding and decreased sensitivity, period.
Yes.
And there's significant improvement. Women love it. And why not bring that nipple stimulation back into your sex life with, again, increased sensitivity, arousal.
Dr. Durst is bringing sensitivity back.
We're bringing sensitivity back to the nipples. Like, we highly recommend it.
We offer it to everyone. Getting an O shot or a P shot. We've spun the blood down. Why not? We already have it.
Yeah. Can you tell? I think nipple stimulation is important. Yeah. So anyhow, we'll do another podcast that talks a little bit more about the nipple facts, the fun facts about nipples.
Absolutely.
But just keep in mind that you can use PRP to reintroduce stimulation of the nipples and get, improved orgasmic strength sometimes with that.
And improved orgasmic strength with the O shot. And then improved erections with the P shot.
Yeah.
So we offer all the things.
All the things.
If you guys have any experience with any of those things, please add comments. We love to hear about your experiences and let us know.
And hopefully a lot of our patients will go on and comment because we've had such positive feedback with the nipple PRP. So again, let us know if there's anything you want to hear about. Hit the bell, subscribe, like, share with friends. And we're willing to deep dive into anything sexual wellness. And we're here to revitalize your look, your health, and your sex life.
Thank you.